Hi all. Welcome to OET Speaking and Writing. Today we can do a role play. This is the card for you. Please have a look on these card. You will have 3 minutes for the preparation. Good morning. My name is Sarah and I'm a registered nurse working in this hospital. How is Maria feeling? Oh, well, my daughter, she's having ear pain. I'm really worried about. It is understandable to feel worried in this situation. Try not to worry. We will give her the best possible treatment. Can I ask you some questions regarding your child's condition? Yes, nurse. When does she have this pain? She's been having a few weeks. Night she tries awake. And at first, we thought it's a common. For which is giving medicines at home. But now it's getting severe. She's crying every time. Have you noticed any smelly wax or ear drainage that's coming out? Yes. Was she having fever? A little bit. When did she start having that? She is having that 2 days back. So don't worry. We are there to help you out. So what I understood that is, like, your daughter's having a ear pain for past 2 weeks, having drainage coming out there. And she's feverish. So, these are some of the sort of problems that your daughter's having. So the first thing I will tell you, what are the causes for an earache to happen? Do you know what are the causes? No, nurse. No problem. I will explain to you. There are a lot of causes are here. It could be there because the building up of the fluid deep inside your child's eardrum. That means inside your child's ear, there is something called as aerodrum, that is the place where it makes us to hear sounds. Sometimes there can be a lot of fluid accumulation over there. That is one cause of earache. The second thing, maybe, the infection of her ear. We can see a lot of hair follicles inside the ear. Sometimes even a hair follicle can be infected, or maybe even she can have a small blister there. So those all can be a reason for having a ear pain. Then what we should do? We are going to provide treatment like medicines and ear drops. You need to instill into her ears and see that how effective is going to become, but it could be better if you do it at the night time. Yes. You are right. What all precautions I need to take? Check whether she's not putting anything into ears. Take appropriate rest and avoid vigorous activities. These things all are very important for the speedy recovery. Yes, nurse. I am so happy to hear that. I do understand that being a mother, it's very troublesome and it's very sad. I certainly understand. Don't worry, that's why we are here to help you out, and your daughter will be fine if you take all the medicines at the right time. If she take things properly, definitely, she would have a speedy recovery. Oh yes. Is there anything else to share with me? No, nurse. If you need any help, please press the buzzer. Thank you. I wish her a speedy recovery.